Good evening, Maz. Good evening. Good evening, everyone.
Good evening.
Good evening, Maz. Yes, ma.
Good
Good good evening. So, you're welcome to this the third edition of our medical podcast. On behalf of the Medical Think Tank Committee, chaired by Professor Olufunke Adeyeye, I welcome everyone to this meeting today, this podcast. I say good evening to Her Excellency, the First Lady of Lagos State, Dr. Mrs. Ibijoke Sanwo-Olu. Good evening, HEDG, Chief Mrs. Oluremi Amzat, and good evening, COWLSO sisters and mommies and aunties. This is the third edition of our medical podcast, which today we're going to have this topic, sudden death, causes and the risk factors, and it's going to be anchored by Dr. Adiola Ajibare, who is a consultant cardiologist at LASUT. He will be giving us a very, very insightful insightful session concerning this topic. And he's presently also with us. He's joining us now. So kindly go to this to the COWLSO WhatsApp group. We're going to ask you some questions bordering on this topic, just to find out how much we know. And then after this podcast, we're also going to ask you similar questions, just so that we know that we are all following this topic and that all of us are becoming enlightened as a result of this podcast. So you're all welcome to this session. I think we can do the poll right now. We can go ahead. Mrs. Olonrinu, kindly share the poll on the platform. So everyone that has logged in, please go on the WhatsApp group for COWLSO to answer these 5 questions, just to find out how much we know concerning this topic. And then after the podcast, we'll also be asked the same question, so that we know that we have gained something today. So please go ahead and answer this question. It won't take you more than a minute. Thank you, everyone.
Okay. Thank you very much, Dr. Okeosanyitolu. So the poll is already on screen. Please let me know if we can all see it. If we have access to it right now here on Zoom. If you have access to the poll, please show me with a raise of hand.
Have we all seen these questions? There are 5 of them. Please answer the one that you feel is the correct answer, so that we can start the podcast. Thank you very much.
All right, thank you. I see some people have seen it. They're raising their hands up. Please let's fill the pre-test. So we have about just 5 minutes for that. Thank you very much.
Thank you. For those of us that are just joining on the call, what we're doing right now is to answer the pre-test questions, the pre-podcast test questions. We would like you to kindly go through the questions and pick the most appropriate of all the options, and then we'll start the podcast shortly afterwards. Thank you.
Sorry, we're unable to see the questions again.
Oh, yeah.
Ms. Olorino, please.
Yes, they've disappeared.
Yeah,
they
disappeared while we were trying to answer them. All right, I'll try them. I'll share one more time.
Okay.
I'll relaunch the poll.
Thank you very much.
Yes, we can see them now.
Okay, please answer them. For those that are just joining on the call, once again, we're just trying to answer the 5 questions. They are pre-test questions for the podcast before we have the podcast. So please go through the questions and attempt to answer all the 5 questions. And then after the podcast, we'll be able to compare notes with what we knew before the podcast and the knowledge we have gained after having the podcast. Thank you very much. So we have less than a minute to do that so that we can start the podcast.
Okay, so we can have
Can we go ahead?
Dr. Ajibare can unmute.
Okay.
When he's ready.
Dr. Ajibare, please unmute your mic so that you can start your lecture.
Good evening. Can you hear me?
Yes, we can. Please go ahead.
Yes, we can hear you, sir. Would you be willing to share your screen?
Yes, I will.
Okay.
Okay. So I can give you.
No.
Okay, can you see my screen now?
Yes, sir, we can.
We can see it.
All right. Thank you, Mr. Lorin, for the questions.
Okay.
Okay, so I can end the poll now.
Yes, ma'am. Thank you very much.
All right.
Thank you. So, Dr. Ajibari, thank you for coming. So,
Thank you very much. Oh, okay. Thank you very much for inviting me for this program. Firstly, I want to appreciate Her Excellency, the wife of the Governor of Lagos State, Dr. Mrs. Ibijoke Sanwo-Olu, and as well appreciate the wife of the Deputy Governor, Mrs. Oluremi Hamzat. At the same time, I want to appreciate my boss at work, Professor Olufunke Adeyeye. And Dr. Osonyitolu, thank you very much for our back and forth and for everything. And
thank you.
finally, I want to appreciate everybody that is on this call. So today I'll be speaking about sudden cardiac death, and we'll talk about the causes, we'll talk about the risk factors, and of course, our conversation will not be complete without talking about how to prevent it. And we'll be doing it under this outline. And I love this picture, and it depicts the three phases of life. The first on the picture is a young person, while in the middle, we have somebody, in the middle phase of life. And the last one is the elderly. And you agree with me that people that are less than 20 years, we have a whole lot of time on our hand. We have so much energy, but that is when we don't have money. Then when we now move into the second phase of life, that's when we start working. Then we have the money start coming in. We still have a whole lot of energy. And that's when people will say that I don't have time. You don't have time for rest. You don't have time for anything, And when we now get to the last stage of life, which is elderly, you discover now that you now have the money, you have the time, but there's no energy. It gets so bad that some people, after amassing so much wealth, they can't even climb up the stairs of their duplexes. They have to move down to the maid's room. So at that period, and you now realize that, most of the energy has been spent in this middle age. Now, you also agree with me that if anybody dies, in this phase of life, that's the elderly phase of life, it doesn't usually generate a whole lot of discussion and controversy. But when people die, when they are less than 65, that is when, we are talking about sudden cardiac death, and we start talking about it. And I'm sure that many of us, if I ask people on this call that have you had or have you seen someone that died suddenly that you were not expecting the person to die? And I'm sure we have a whole lot of people to refer to. However, I will remind us about some few ones that had come into conversation in the past few years. We don't remember Samuel Oparaji. Many of us remember him as a footballer. But a whole lot of people don't know that this man was also a lawyer. He has a master's degree. He died suddenly while playing at the National Stadium. So you will agree with me that somebody who is sick is not likely going to want to go and play ball. And a coach is not likely going to field somebody to play football if he knows that the person is sick. So apparently, Samuel was thinking that he was okay. He feels that he was well up to that morning that he died suddenly at the National Stadium. And also, there's this story that was on the Sunday Tribune of the 3rd of July 2011 about a man who went with his lover to an hotel room to have fun. Unfortunately, the man died. And you also agree with me that this man probably felt that he was okay. And that was why he went out, to book an hotel room with his lover, with the lover. And this is another story of January 19, 2015. This to tell us that sudden death is not a respecter of your profession, is not a respecter of your status, is not a respecter of your religion. So we had a professor of medicine that died suddenly of cardiac arrest. He was 56 years. Also, we're aware about this story of the 1st of November 2017. The son of a prominent Lagos politician died of cardiac arrest in London. And we had this story in 2019 of an Islamic cleric that died while delivering the Juma service, a lecture during Juma. And I'm aware that a whole lot of us would identify with this story that was on Facebook in 2019 about a young lady, a teacher in a school in Benin City, who was seen dancing on, in a video. All of a sudden, she slumped and she died. She was wearing an Ankara. I'm sure many of us knew this. But what I'm taking away from these stories is that she had warning signs. Some other people may not have warning signs, but she had warning signs, and she probably ignored those warning signs because she was said to have been hypertensive. She was said to have been ill 3 months prior to the time that she died, and she was said to have collapsed. She was having headaches that morning, but she still ignored those warning signs. And this story is of a pastor that was published in Punch newspaper in 2022. It's just to tell us sudden cardiac death is not a respecter of your religion or whatever you do. So also, we had a story of this bride that died on her wedding day in Ogbomoso. I mean, she probably felt that she was well and she was, happy, joyous, and all that. So this is just to tell us a few of the sudden cardiac death that we have reported in a while. It is not a respecter of anybody. It may come with warning signs. It may not come with no warning signs. But at the end of this lecture, we will be able to know what to do, to prevent this kind of sudden deaths. So what is sudden deaths? So it's usually sudden, it's rapid, it's unexpected. So those are the things. This is not something that, you are predicting that this person is going to die. So that's the reason why it is usually, very catastrophic when it happens, because you are not expecting this person to die. And many times it occurs within 1 hour or within 24 hours of the onset of symptoms. So that means somebody can be fine, then it now starts to decompensate, then all of a sudden it now passes on. And the thing from this slide that we need to take away is that it may happen in somebody with a known existing cardiac illness, or the person doesn't even have an identifiable cardiac illness before the death. And most of these deaths, they are usually cardiovascular in origin. And cardiovascular meaning that the cardiac meaning heart, then vascular means blood vessel. So since blood vessel moves around all parts of the body, so it may be a disease of the heart, it may also be a disease of the blood vessels. And many of these diseases usually comes from a problem in the blood vessels, like something is depositing inside the blood vessels, like cholesterol plaques, when they say that, we'll still talk about it. When somebody has a whole lot of cholesterol, it starts depositing inside the blood vessels, and it could cause, deaths and diseases. And most of these deaths, like we said, they are sudden and they usually occur outside the hospital, and that is why it's very sad. If it happens in the hospital, it could be reversed, by using some equipment that we have in the hospital. But 89% of these deaths occurs outside this hospital. And more than 1/3 of all global deaths are from the heart and the blood vessels. This is according to World Health Organization. So what are the common causes of these deaths? So the commonest cause, as we have seen in our pre-test, the commonest cause is still hypertension and its complications. So hypertension meaning that the blood pressure is high, is greater than or equal to 140/90. And if it is sustained and nothing is done about it, it could lead to heart attack, it could lead to stroke, it could lead to heart failure. Then the biggest vessel from the heart is the aorta. So when the heart keeps pumping at a higher pressure, it could now start causing some indentation in this aorta, which can rupture and the patient can die from it. And of course, arrhythmias means that there are abnormal heartbeats. So when you start hearing your heartbeats, because the heart pumps blood and you are not supposed to be aware of it, then when you now start having that feeling that your heart is beating, is called arrhythmia. That's abnormal heartbeats. So those are the complications of hypertension, and they are the commonest cause of sudden death. However, there are other things like when people use illicit medications, illicit drugs, drugs that are not prescribed to you, and we are beginning to see a whole lot of abnormal heartbeats and sudden cardiac death that come from highly caffeinated energy drinks. And when people have electrolyte imbalance, probably from kidney failure and some other things, it can lead to cardiac death. Cardiomyopathies means that there is disease of the muscle layer of the heart. It could be hereditary. I mean, when somebody can pass it on from himself to his children, or it could be acquired. Valvular disease means that, the heart is a multi-chamber organ. And from one part of the heart to the other, you have, like doors, like gates that moves blood from one place to the other. When these doors, which are called the valves, when they become diseased, they can lead to sudden cardiac death. Like I mentioned earlier, aorta is the biggest vessel that takes blood away from the heart and, supply all the organs of the body. When this heart is pumping at a higher pressure than normal, it can cause, condition in which the aortic valve become diseased and start having out pouches, and it can rupture and cause problems. Diseases of the body that can cause abnormal heartbeats, then for one reason or the other, whether because the person has a predisposition to it, or because he has a sedentary lifestyle, or because he had a long distance travel, or he's taking some medications, blood clots can begin to form in the vessels of the body. And when this blood clot travels to the lungs and obstructs, the flow of blood and oxygen, that is what is called pulmonary thromboembolism. And it is also a cause of sudden, death. Then congenital heart diseases, meaning that a child is born with a hole in the heart. It may be diagnosed at birth. It may also be diagnosed in adult life. We all remember the story of Kanu Nwankwo. Kanu Nwankwo had a congenital heart problem, which was not even diagnosed until he was moving from one club to another. So he spent all his life, playing football, only to discover that he had, an unrepaired congenital heart disease, later in life. So if it was not tested for, it probably wouldn't have been discovered, and he may have gone that way. Also, if somebody has a family history of sudden cardiac death, it is, something that you should, investigate and know whether you are prone to having sudden cardiac death. Like I said, we would continue to emphasize hypertension. So the common culprits when it comes to these deaths are hypertension, stressful lifestyle, you walk from pillar to post, you only sleep for 2 hours, you sleep for 3 hours, no work balance, it could, those are the culprits. Alcohol, cigarette smoking, cigarette smoking will cause hardening of the blood vessels, it will cause damage to the lungs and all that. Obesity, gone are those days that they used to see, how obese you are as a measure of affluence. Now, the bigger you are now, the more disease risk that you are prone to. And of course, diabetes mellitus, when you have abnormal blood sugar, and use of illicit drugs, those are the common culprits when it comes to sudden cardiac death. Then at this point, I still have to talk about these risk factors again and again, because if we don't stress it, we would not be able to take something home. So these risk factors can generally be classified into two. The modifiable ones, those are the ones that you can do something about, and the non-modifiable ones, those are the ones that you will not be able to do anything about. So non-modifiable, like advancing age, as you are getting older, your skin gets to wrinkle, your hair gets to get gray, then your organs of the body too, they get older. So there's nothing you do about that. And we all pray that we get older. And of course, the gender of the patient is said that before menopause, women are protected by their sex hormone against some of these cardiovascular disease. However, by the time a woman achieves menopause, it has the same risk as that of a man. Then if you have a previous history of heart condition, or you have a family history of heart condition, there's nothing you'll be able to do about that one. Those are some of the things that you have inherited. Then those are the non-modifiable ones. So we don't want to, waste time talking about those ones. However, the modifiable risk factors, those are the ones that we still have power to do something about. Example including hyperlipidemia or dyslipidemia. Hyperlipidemia means abnormal level of cholesterol in the blood of a patient. And how will you know? You won't know until you test. So many times, by the time somebody has dyslipidemia, there is a very high level of cholesterol in the blood. It will start depositing inside those vessels and now cause problems, later in life. Smoking, like I said earlier, it will cause hardening of those vessels. It will increase the blood pressure. It would, make somebody too prone to having heart attack, sudden cardiac death and all that. Diabetes mellitus, you still have to take your medications to control it. Hypertension, like I tell my patients, it is not a death sentence. All you just need to do is to get it diagnosed and start taking your medications. And the moment your blood pressure becomes normal, then your risk equilibrates with those people that have normal tension. So just continue taking your medications and you will, you'll be fine. Then physical inactivity. If somebody is sedentary, you don't exercise at least minimum of 30 minutes every day, you are termed as, being inactive. Then overweight, obesity, just like I said. And by the time you are eating diet that is high in carbohydrates, salt, and fats, those are precursors to having, elevated blood pressure and other cardiovascular disease. And still to emphasize what we are talking about in hypertension. Hypertension risk is more than that of, indoor smoking, childhood, underweight, alcohol use, unsafe sex. When you bring everything together, high blood pressure is still far, 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 more than all these ones. And about 17% of world mortality or all world death can still be attributed to hypertension, while about 31% of mortality of the world can be attributed to cardiovascular diseases. So we need to protect our heart. So this is still telling us about the prevalence of hypertension. About 26%, a quarter of world population have hypertension, and it's predicted that by next year it's going to increase to about 60%. So we need to take care of ourselves. We need to check our blood pressure, and we need, to be on top of this menace at all times. This is still stressing, about hypertension being one of the leading cause of deaths worldwide. However, while talking about hypertension, we should not only concentrate only on hypertension. Like this doctor now, this man came, he has a whole lot of cardiovascular risk, but the only thing that is showing the doctor is just the blood pressure. So the doctor can get carried away, treat only the blood pressure, and leave the fact that this man is a smoker. This man is taking, a whole lot of alcohol, as seen in his right hand. Then this man is obviously obese. So this man is a conglomeration of, cardiovascular risk factor. But the only thing that is showing his doctor is just the blood pressure. So this is just to further emphasize that, yes, as much as we are emphasizing on hypertension, there are still other cardiovascular risk factors that we need to talk about, and we need to disclose it all, to our physicians so that they will know how to handle us and take care of us. So you know that this is a popular, scenario in every home. In the 90s, the televisions were very big, and while the human beings were very slim, they didn't have a whole lot of cardiovascular risk factor. But these days now, we have exchanged the cardiovascular risk factors. Televisions are now super slim, while the people are grossly obese. So this is to, emphasize that we need to do more, when it comes to our cardiovascular disease. And many times you see people at the end of the day, they get back home and they say that, oh, how much do I even spend on myself? I spend most of my money on my family, my relatives, my car, my everything. So let me even enjoy myself and all that. But by the time you are enjoying yourself to this level, you are increasing your cardiovascular risk, and you are increasing, the incidence of sudden cardiac death. And these are some of the cardiovascular risk factors that we're talking about. Cigarette smoking in any form, whether e-cigarette or direct smoking, lighting fire, taking excessive alcohol, they all contribute to cardiovascular, risk factors and sudden cardiac death. So we did a study among the members of an elite club in Lagos, and we published it in the Journal of Epidemiological Society of Nigeria. And what we found was very alarming. We discovered that cardiovascular risk factors is now becoming an epidemic in the urban area. We found a prevalence of hypertension to be about 61.7%, obesity about 65%, and abnormal cholesterol about 80%. The unfortunate thing about all these things is that most of these people that we screened did not even know that they had all these risk factors with them. So to further stress these risk factors, what are these risk factors again? Overweight, when you're eating unhealthy diets, diet that is high in cholesterol, high in salt, alcohol use, you have low physical activity. Example is this man in the middle, he's obese, he's lying on the couch. He wants to pick the remote control that is directly in front of him. He's still sending, the house girl or the son to go and pick remote for him. Cigarette smoking in every form, stress, when you are taking certain medications that are not prescribed for you, you have other certain.
Come up. I can't hear you.
Sorry. Okay, so low level of vitamin D as you are getting older. Once you celebrate your birthday, you know that you are getting closer, to the grave. Then if you have family history, you need to work on it. Gender, like we have said before. And some of the things I advise my patients to do is that on your birthday, that's the best time to give yourself a birthday gift. Go and do, health screening. Go and check yourself. You can celebrate your birthday and feed it, 1,000 people. They will eat and they will go. But what exactly are you doing for yourself? If you buy a car for yourself, you need to know whether you are healthy enough to ride that car. So at this point, we now need to talk about symptoms of cardiovascular disease. So you have cardiovascular disease. How do you know? How do you know that you are prone, to having sudden cardiovascular death? Unfortunately, many of these cardiovascular diseases are silent killers, unfortunately. So many times they don't give any symptoms until some people, the very first symptom that they're going to have is death. And it's very unfortunate. So that's the underscore fact that we need to check ourselves, from time to time. However, some people can have headaches, some people can have sleeping difficulties, some people will have easy fatigability, the distance that you could walk, previously, you now find it difficult. The stairs that you were climbing before, you now find it difficult, you get tired easily. Then by the time you start hearing your heart beats, then that's what we call palpitation. So when you have leg swelling, whether one of the legs or both of the legs, you need to get yourself checked. Then when you start having blood vision, dizziness, loss of consciousness, like that lady from Edo, she had loss of consciousness 3 months before she eventually died. But, those are the warning signs that gave. So how do we prevent sudden cardiac death? The first, most important one is that you have to have regular check. Because if you don't check your blood pressure, you won't know you have hypertension. If we don't take your blood and check for abnormal lipids, we will not know whether you have abnormal cholesterol in your blood. So you have to have yourself regular, you have to check yourself regularly. We'll still talk about the regularity of the checks. Then once you now identify an ailment, then you have to treat it. Especially chronic illnesses like hypertension and diabetes, you need to take your medications every day. I tell my patients that hypertension is not like malaria, that you take one medication and or you take it for 3 days, or antibiotics that you take for 1 week. Chronic illnesses means they are lifetime or long-term, illnesses. So you need to take your BP and your diabetes medication. Then you will need to stop tobacco in any form, whether passive smoking, active smoking, or third hand smoking. You need to find a way to avoid tobacco. Then you cut down the level of your alcohol, you engage in healthy lifestyle, healthy eating, healthy living, low salt diet, regular exercise. Like I said earlier, you need to do a minimum of 30 minutes of exercise, at least 5 times in a week. That's 150 minutes, minimum of 150 minutes of exercise spread on different days of the week. Then you need to rest and have vacation. So we need to know when to stop working. We need to know that, when I have some level of rest, and you have to, find time to sleep properly. The idea that you are getting up at 11, 12, you are sleeping at 1, you wake up again at 4, 5, that is, a recipe for disaster waiting to happen. And above all, it is not everybody that died suddenly that had warning signs. So if you have warning signs, please don't ignore these warning signs. You see, you are having problems sleeping, you're having headache, you're having palpitation, you're having leg swelling, you're having dizziness. This is the time to get yourself checked so that we don't push ourselves to sudden cardiac death. So what are those things that we can do as lifestyle medication to manage hypertension, manage cardiovascular risk, and and prevent sudden cardiac death? So we need to lose weight if we are obese or overweight. Once your BMI, that's the body mass index, is more than 25, you need to find how you're going to lose the weight. And research has shown that by the time you lose up to 10 kg of your weight, your blood pressure itself can drop by about 20 milligrams of mercury. Then you have to consume a whole lot of fruits, vegetables, reduce the salt in your food, reduce your calorie level, engage in physical activities, like we said, and reduce alcohol and avoid cigarettes, smoking at all times. So why do we all, everybody, we need to have ourselves checked? Because most illnesses usually start small, and many times they don't even give symptoms. So it is better you catch it when it's small so that we nip it in the bud. And of course, as you're getting older, your body system gets older, then you also need to check it. So when you detect an abnormality early, you will be able to, prevent it from escalating. So there are some people that have normal body variation. You need to know what your body variation is, early. And it would help us to institute preventive measures, and it will also help other family members, because there are some familiar diseases that once somebody has, you need to screen other members of the family to know whether they have this kind of diseases. So we need to do our health screening. So how often should we do it? So the best answer to that is that you need to do it as need be. If you're under the age of 30, we recommend that you do it every 2 years. If you're above 30, you need to be doing it on yearly basis. And of course, for those that are above 50, then you now need more age-related, tailored screening to your age. So, and for some people, depending on what we find, you may need to be doing it even more frequently, because we'll use this to monitor and for treatment and for follow-up. So what are the examples of, the check that we advocate? Routine blood pressure check. You need to check your blood counts to know whether you are anemic, whether there's other things, other chronic diseases that is there. Your cholesterol level, which is a level of your lipids, we need to know it. So if you have abnormal lipids, before they start depositing inside the blood vessels, we need to nip it in the bud. Diabetes screening, cardiac screening like ECG, echocardiography if need be, chest X-ray, kidney function test. For males, we do, prostate check, especially when you're above 40. For women, you do mammograms and pap smear, liver function tests, and colorectal screening have now been said that it should be done in everybody that is above 40 years of age. So what are the common excuses that I've had in my practice? Some people will tell you that you tell them to go and get themselves checked. They say, I'm not sick. Why do I need to, go and check myself? Some people will say that I don't have money. And the question I ask them is that how much is this health screening that we are talking about? Many of them don't even know, but they just assume that it will be expensive, and these are some of the things. Some people will say that the hospitals or where they are going to do the tests are so far away. And of course, I am too busy is one of the excuses that we get all the time. But by the time you are saying I'm too busy, this is exactly what you are going to do to the health burden of on doctors. Because as we speak now, there is so much, burden on us. So the more we prevent these illnesses, the lighter our yoke will become. So in conclusion, I want to say that I want to advocate that we all take care of ourselves, because we are the best person that can take care of ourselves. If you don't do it, nobody will do it for you. And in case anything happens to you, if you become unproductive or you die, you will be replaced almost immediately. And of course, we all know that prevention is cheaper, easier, and better than cure. And we are all precious to our families and friends, so we need to stay alive and be healthy. Thank you very much for inviting me to speak today. I appreciate it.
Thank you very, very much, Dr. Ajibare. Thank you so much. That was a highly insightful session. And I believe that we have all learned a lot. So on behalf of Excellency, the First Lady of Lagos State, I want to say thank you to you. And also from the medical think tank and the entire COWLSO body, we really appreciate you, sir. We have learned a lot. And so I'll, open the floor now for few questions, within the time limits that we have, and any other question that comes afterwards will also be answered. Rest assured, we'll forward the answers to you. And then don't forget, we're going to take another post-test, another post-podcast test. Everyone has to go through this test again, especially those that did the first one. And for those who didn't do, please, you have to also join in at this point, so that we want to know what didn't we know before that we now know, and then be very proactive about it. So I'll leave the floor open now for few questions within the time limit. Thank you very much. So anyone that has a question can please go ahead. Kindly signify, by the raising up of your hand, and then we'll call you, and then we can, Dr. Ajibare is still in the house to answer our questions today. So please, the floor is open. The floor is open for any question from anyone.
So while we wait for questions, Dr. Ajibare, I do have a question. And my question is relating more to there's this new trend, so to speak, that I did come across, because I had some people asking me if it was okay and stuff like that. So I want to ask you, as an expert, that there's this new drug called lipocarnate. I think it contains L-carnitine or something, and it's like a fad now where a lot of women, use it for weight loss. So, I just I want you to be factual with us, if it's actually okay, if there are actually no side effects, if it's something that the body produces naturally, and then it's just fine. You're just trying to boost it and all of that. So please, just help us in this regards to answer that question about the L-carnitine, and if it's okay to use, because I understand that you mentioned so many things about the cause of what excess weight can cause, so it's just if it's something that we can actually use on the side, or that can be helpful aside from all of the things you mentioned, exercise and all of that, and calorie deficit and everything. So that's one question. I don't know if you want to answer now, or you want to ask the other questions and then you answer everything together.
Okay, I will take all the questions.
Yes. All right. So the next person, Olainka Lai Adete, please, can you unmute yourself and ask your question, ma'am?
Thank you, ma'am. Good evening, everyone. Good evening.
Good evening, ma'am.
So my question is it normal for someone's blood pressure to be up, especially when they are just getting out of bed?
Okay. All right. Thank you, ma'am.
Thank you.
The next question. Is there anybody else who wants to ask a question on this topic? Dr. Ajibare, I have one question for you while we're still waiting for other questions. What about non-cardiac causes? Because I see that you've reeled out a lot of causes of this sudden death. And I know diabetes is there, some other ones, but kindly just enlighten us on other causes of sudden death that may not be related to cardiac issues. So we have another question from Olaumi Sule. Please unmute yourself, ma, and ask your question. Mrs. Olaumi Sule, please unmute yourself, ma, and ask your question. Mrs. Sule, please ask your question, ma. You have the floor.
Good evening, doctor.
Good evening, ma'am. Good evening, ma'am.
Yeah. I want to confirm and clarify if high cholesterol is treatable, curable, or just manageable.
Okay, ma'am.
Thank you, ma'am.
Thank you, ma'am. So, Dr. Ajibare, are you okay to answer these questions now?
Okay, thank you very much. Let me start from the first one. The use of L-carnitine, or maybe I should just talk generally about the use of medications for weight loss. Okay, so the first thing we need to understand about weight gain and weight loss is that all obese people eat more than what their body needs. So I repeat again, all obese people eat more than what their body needs. I didn't say that obese people eat more than non-obese people. But for you to be obese, that means you have excess of calories that your body is storing. So what you do when you want to lose weight is to reduce your calorie level and increase your level of exercise. So it's like income and expenditure. So the income is what goes into your mouth. Expenditure is the rate at which you burn, the calories that you take in. So if your income is more than your expenditure, you have surplus. If your expenditure is more than your income, you have deficit. So the goal of losing weight is for your level of exercise to be more than the level of your calories intake. So that's the first thing about weight loss. Then the second thing is that all medications have side effects. So that's the basic truth. All medications have side effects. And the most sustainable form of weight loss is the one that is driven by discipline. Discipline meaning striking a balance with what you take in and how you burn it. And by the time you reduce your calories and you increase your level of exercise, some people will tell me that, but doctor, I don't eat so much. Once I eat once a day and I take a bottle of Coke and that's all for the day, I don't even do anything. Then I ask them that the calories in a bottle of Coke, you need 1 hour and 4 minutes. That's 64 minutes of active exercise to burn, the calories just in one. So in the long run, the most sustainable way of, keeping your weight or losing weight is to strike a balance between your intake and your output. Injectables, whether is, I don't advocate for any form of medical, using therapeutics or medications to lose weight. So that's that. Then the second question is that, is it normal for your blood pressure to be high in the morning? So the normal circadian rhythm, the normal way that the body is structured is that your blood pressure rises in the morning and it goes down, as the day goes by. So that's the normal. However, in the rising of the blood pressure should not exceed 140/90. So there are two parameters to the blood pressure: the systolic blood pressure, which is the upper one, and the diastolic blood pressure, which is the lower one. So the up one should not get to 140, and the down one should not get to 90. However, if your blood pressure hits 140/90 on two different occasions, then that means you are hypertensive. Then you now need to start taking medications to bring down this blood pressure. Then the other one is that there are other causes of death. Of course, there are so many other causes of death. So there could be the ones from communicable diseases and the one from non-communicable diseases. So, of course, the non-communicable diseases are myriads. The commonest one of them is hypertension, which I talked about. So I also mentioned diabetes. I mentioned thromboembolic phenomenons. That's the one that you have blood clots. I mentioned cancers. I mentioned the use of tobaccos. There are so many. So I just didn't want to crowd the presentation. That's why, I specifically honed down on the non-communicable one, which is hypertension, diabetes, dyslipidemia, and all those ones, so that we can, take something home from this presentation. Then the last question is high cholesterol curable? Okay, so this is how it is. There are two major ways in which you treat high cholesterol. So you have the lifestyle modification modalities and the medications. So many times it depends on how high your cholesterol is. That's what will determine whether we are prescribing medications for you or not. However, if your cholesterol is not very high, will tell you that you should go and do lifestyle changes, cut down on those things that would increase your cholesterol, like all these oil that have sediments, all those ones that they are not, they have high level of cholesterol. By the time you put them on your shelf or you put them inside fridge, you start seeing sediments inside. Or you eat plenty of meat, red meat, or you eat, even melon, granules. Some of them have been shown that they increase the level of cholesterol. So we tell you that you should reduce the level of your cholesterol that you take in. Then number two, you need to do a whole lot of exercise, just like we said, 30 minutes, on daily basis, at least 5 times in a week. So when you eat plenty of fruits, eat plenty of vegetables, so by the time you do all this, if your cholesterol comes down naturally, we just tell you sustain your lifestyle changes, then you don't need medications. However, for many people, it is very difficult for them to, sustain that lifestyle changes because number one, many of them will eat out. There's no regulation to, what people put in their food outside. So people may tend to use very bad oil, to make sure that they have, profits on all these things because the bad things are cheap. So they will always use those ones. So if you cannot now reduce your cholesterol with lifestyle changes, then you'll be on medication. And you will be on that medication for as long as that cholesterol is high. However, once that cholesterol now comes back to normal, we may now tell you that you should sustain that normality with your lifestyle changes and will now gradually wean you off medications for cholesterol. Thank you. I think I've answered the 4 questions that I have.
Thank you very much, Dr. Ajibari. We would also like to appreciate the presence of our mother, the First Lady of Lagos State, Dr. Mrs. Claudiana Ibijoke Sanwo-Olu. She's with us, and I think I want to leave the floor open to her, if she has anything to say to us concerning this topic. Over to you, Echima. Oh, she can't unmute. So, well, you have best regards. Thank you very much, Dr. Ajibari.
I just unmuted her, and I think on the call too is Her Excellency Chief Mrs. Oluremi Amzat as well.
Oh,
she also had
okay.
a question she wanted to.
Okay,
she was watching on YouTube, and then she had a question to ask. So she called me. Yes, but
okay.
I did send her the link right now, so I don't know if she's also on this call. But
okay.
yes.
So
Okay, thank you, Dr. Ajibari. Thank you very much for honoring the invitation. I was listening with rapt attention. I'm sure a lot of our women have gained a lot from what you have said today. I hope we'll adhere strictly to the advice that you have given us. A lot of useful tips had come out of today's discussion. And every time we have our podcast, like the presenter said, we have the pre-test and the post-test. So I'm really looking forward to the impact assessment of what you have taught today, whether they gained anything or not. Once again, thank you for honoring the invitation.
Thank you very much, ma. Thank you, ma. So on this note, I think the post-test questions can be sent out. Ms. Olorino, please kindly help us to send the post-test questions so that the participants can answer the questions and see how far we've come.
Yeah,
In the last
I'll
one.
do that. I'll do that
All
right
right.
away.
Thank you,
So
ma'am.
Our Excellency Mrs. Hamzat does have a question, and our question is as regards what's the ideal number of steps that one can have or one should have to do every day to help with weight management majorly, and of course to avoid sudden death cases and issues. So please answer the questions and then we'll move over to the polls.
Oh, thank you very much. Our Excellency, Dr. Ibijoke Sanwo-Olu, I appreciate you. Thank you for inviting me. And Chief Mrs. Oluremi Hamzat, thank you also for the invitation. Okay, so concerning the number of steps that is ideal on daily basis. So the first thing I need to say is that if you are taking less than 5,000 steps per day, that's sedentary. So if you are taking less than 5,000 steps per day, that is a sedentary lifestyle. So we need to take above. Ideally, we should take more than 10,000 steps per day. However, between 8,000 to 10,000 steps is it's okay. So, but less than 5,000 steps is not okay. Ideally, it should be more than 10,000, but 8,000 to 10,000 is acceptable. And I think there's another question on the group, on the message. Sorry, I can't access it.
There are a few questions in the chat room, Dr. Ajibari. One of them is yes, the long-term side effects of antihypertensive. Somebody wanted to know.
Oh, okay. Just like I mentioned when we're talking about using medications for weight loss, and I said all medications have high side effects. Yeah, the same thing with BP medications. They all have side effects. If you read their leaflets, you see a whole lot of side effects that are written there. However, those side effects, they don't happen to everybody. So, and one of the things that the doctors look at when they are prescribing, and some of I think I mentioned it during my lecture that some people take medications that are not prescribed. If both of us are hypertensive now, we may be on two different medications. We may be on different medications. So one of the things that a doctor would look at is look at your profile, look at the medication that best fit your profile before they prescribe it to you. So yes, all the medications have side effects, but what we do is that we look at the profile. At the same time, we also look at the risk and the benefit of the medications that we now prescribe it. So before we prescribe any medications for you, we are 100% sure that the benefits of giving you that medications outweigh the risk that you're going to have from those medications. So having said that, so some side effects of those hypertensive may include leg swelling, they may include headaches, some people may cough to some, and of course, they are molecules, they are medications. So it's not as if they have brain to now say that, okay, when the blood pressure gets to around this area, stop. Sometimes those medications can even cause hypotension, So, but once you are taking your medications, you continue measuring your blood pressure, then you keep going back to your doctors for, follow-ups. So it is not enough that you say that you have a side effect of a medication and you now stop it entirely and you don't go back to your doctors. Your blood pressure is going to rebound and it's going to cause more damage to you. I don't know if I've answered that question, then I can take some.
Yeah, thank you very much. So, Ms. Olorino, kindly share the post-test slides, the questions, sorry, so that everyone can attempt and answer the questions, and let's see how far we've come. Thank you very much, Dr. Ajibare.
Thank you very much for inviting me
Okay,
once again.
so the post
So
test
please,
is on
yeah,
now.
so the post-test questions are on now. So please, everyone should try and answer the 5 questions. We have 2 minutes to do that. So while we're doing that, Dr. Ajibare, I just want you to shed, a bit of light on the role of garlic, because I know a lot of people take garlic and honey and they say it works for them. What do you think? Is it advisable to take or not to, please?
Okay, so I advocate for any form of natural remedy that are 100% natural. So garlic, like onions, they are, like what we tell people to do: take plenty of fruits, take plenty of vegetables, However, what we don't advocate for is now, the use of excessive salt. So we can use garlic, we can use onions, we can use, locust bean as alternative to salt, so it is advisable that we can use it. However,
Okay.
when you are using all these things, you don't neglect,
The drugs.
your medications. Yes.
Okay. Thank you very much. So we're almost done. And then before you go, Dr. Ajibare, just tell our COWLSO audience, COWLSO aunties, mommies, and just, what is the best oil to cook with? Is it palm oil? Is it coconut oil? Is it vegetable oil? Is it canola oil? So that at least, let's start from the diet. What oil is the best, please?
Oh, okay, so that I won't be doing unsolicited advert for companies. So the best oil is the oil that do not have sediments, whether
Okay.
you put it under normal temperature or you put it inside fridge, because there are still some oil that once you put them inside the fridge, not deep freezer, you put them inside the fridge, then the sediments will start coming out. So the
Okay.
best oil to use will be the ones that do not have sediments, regardless of what you subject it to.
All right.
Sometimes when you go to the market, you see some vegetable oil that half of it will be very, it has sediments, then the other half will now. So that's the best oil to use.
Used to cook. So thank you very much. So I think we're all done with the post-test questions, and on behalf of the First Lady of Lagos State, Dr. Mrs. Claudiana Ibijoke Sanwo-Olu, I would like to say a big thank you to you, Dr. Ajibare, for honoring our invitation, for this highly enlightening session on the risk and the causes of sudden death. By God's grace, I believe that all of us have learned a lot. And what we have learned, we're going to imbibe them. We're going to, make sure that we do all that you've asked us to do. Every one of us will take our health as serious issues, and we're going to really make the best out of it. And I pray that in the name of Jesus, none of us will die untimely. Everyone will grow to full old age, because I know that old age is very, very possible. And with all that we've gathered tonight, we're going to make the best of this information and make sure that, we are on top form. All of us will do exercise like Echi would always, advise us to do, that we should move a lot and, try and move our bodies and do the best that we can. So we thank you very much. The Medical Think Tank Committee, chaired by our leader, Professor Olufunke Adeyeye, we say a big thank you to you, and for everyone that has actually come in today to listen to this podcast. Please stay tuned. Next month, we're going to have another session, which will be as highly interesting and, educating. Thank you very much. On behalf of HE, once again, I say a big thank you to you. Thank you very much, Doctor. And thank you, everyone.
Thank you very much, Ma.
Thank you. Thank you, sir. Thank you. Good night, everyone.